All right, we're back with our first guest. Vicki Schwartz is a physical therapist and also the co-founder of IRG Cascade Children's Therapy in Mill Creek, and is going to talk about children's therapy services. This is something that's relatively new to IRG, right, Shannon?
Yeah, Tom, we just acquired Cascade Children's Services, a very well-respected pediatric a PT, OT, and speech clinic working with the youth, the pediatric population. So it gives IRG that family continuum, pediatrics to geriatrics, that we can provide care for.
Here's Shannon and Vicki on Como.
Vicki, welcome to Health Talk. How you doing?
Very well, thank you.
Thanks for joining us. I'm so excited to talk to you. I haven't been this excited in a long time. You know why I'm excited? Our listeners out there, this is Vicki Schwartz. Vicki's a physical therapist. And here at IRG, we've just had this great opportunity that got kind of fell in our lap. We've been able to acquire Cascade Children's Therapy from Vicki and 3 of her partners. Vicki's been around for a long time, has got a ton of experience. Their organization and their providers have a fantastic reputation. I feel blessed. I feel privileged. And my goal is to kind of honor you guys by continuing to provide the great care that you have. This allows IRG to basically kind of have that full continuum of care from pediatrics to geriatrics. But Vicki, thank you for joining us. You're one of the partners there, as said. Tell our listeners about your background.
Okay. Well, I decided to become a pediatric physical therapist when I was 15 years old.
Wow.
Had a summer camp counselor who was in PT school and who loved the idea of working with kids, and I thought that sounds perfect. The next summer, I had the opportunity to work at a summer camp for children with cerebral palsy, and loved the work, and so I was ready to go.
Where'd you go to school?
I went to school at University of Vermont. With that, at the time, was a 4-year physical therapy program. You applied as a freshman, stayed with my 40 other kids in my cohort for every single class for 4 years, had 1 elective in 4 years, and have been working in pediatric therapy ever since.
Vicki and I are both kind of laughing because we kind of come from a similar era of school, and PT school has changed a lot over these years, as has the profession. But what has stayed the same is that kids develop, and kids neurologically have different tracks. And then if you have a condition, like you mentioned, cerebral palsy or something like that, I just want to give a big shout out to all your providers down there. I went to Children's Hospital of Los Angeles. I have so much admiration. Vicki, at 15, how do you engage with children that maybe are they're not communicating, they've got significant neural, that takes a special person.
It takes some patience, and it takes a lot of positive energy. But I've found that no matter what the level that the child is on, everyone craves personal interaction. And so finding where they're at, finding songs, I've done a lot of singing in therapy over the years because on a very simple level, everyone loves that. Lots of colors, just lots of positive energy, and kids respond.
Yeah, and what's interesting, just for our listeners, when you look at a pediatric patient and you look at the developmental sequence, you're trying to assess as a clinician, like where we at here, what is the what's the impediment or what's impeding that development. Your job, which I love what you do, tell us maybe some of the diagnoses you see, then talk about some of your partners. You're a PT, but you do OT and you do speech. Right. This is a collaborative, integrated method, which is great for kids and family.
I have 3 other partners. One is both a physical therapist and an occupational therapist. And my other 2 partners are speech therapists. And we all work together in an outpatient clinic for almost between 6 and 7 years. And when we had kids, we wanted to work part-time. But our employer wouldn't allow us to continue working if we weren't working full-time. So I had this idea that, how about if we start our own practice? And we could kind of control how much we worked and what we did. So we see children from birth through adolescence, and started with just the 4 of us as practitioners, and ended up with a much larger clinic over time, kept on taking all the office space available on both sides from the small office we started with. And we're really focused on children with developmental issues.
More with Shannon O'Kelly and Vicki Schwartz coming up next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Shannon O'Kelly and Vicki Schwartz on the new Cascade Children's Therapy location in Mill Creek.
Vicki, again, thanks for joining us, Health Talk. You know, you're talking about kind of your practice, your collaboration with your partners. You have PT, OT, and speech. Fascinating stuff. The collaboration, the synergies you can create. You talked about developmental issues, and I just want to you and I can talk as therapists here. We both have seen the families and the challenges. I mean, you have a child that's born with a developmental issue. I mean, it's hard as a parent, you know, and the child and stuff. You guys are amazing, and what you do is you're communicating with the children, you're communicating with the families. Tell us about the collaboration and just the cool. I like to use the word cool synergies you have down there.
We all work together. We consult with each other, even on clinical patients we have. We share goals with each other. So when I'm doing physical therapy, I also know what is this child's speech goals? Mm-hmm. What is the child's fine motor goals? What can I do in my session to incorporate all of that and reinforce to the child that, you know, playing and moving and growing is not just moving and it's not just speaking, it's how you do all of those things together.
Maybe just for our listeners, maybe talk about what you're seeing diagnosis-wise, you know, just across the board.
We see a lot of children with cerebral palsy who primarily are kids who were premature or had a traumatic birth. Mm-hmm. Birth injury. We see a lot of kids with developmental delays, no clear diagnosis. They're just not doing the activities that you would expect a child that age to do. Many of whom, you know, get some therapy and help and work on some of the foundational skills that they don't have, and we can discharge them and they do great. Mm-hmm. And love it when those kids come visiting 5 years later. Parents were passing by. They want to stop by and show, like, look, my kid's great.
Isn't that nice?
It's really
how rewarding
wonderful.
Is that? You get to know these families. You watch these families grow.
Yes.
It's amazing. It's
a very, the word we use in our clinic is it's an intimate relationship.
It really is.
I mean, how many people do you see 3 hours a week for their entire childhood? We get to know families, we get to know kids, and it becomes a process of also being able to interconnect families. So you have a new family with a child with maybe a genetic disorder, mm-hmm. and you say, hey, would you like to meet some other families? And mm-hmm. people meet in our lobbies, you know, pre-pandemic,
right.
and make lifelong relationships, and otherwise they also just find people to talk with, to talk about the challenges of having a child with varying abilities. So
yeah, we're running out of time. Vicki, I'm going to have you and your partners back because I want to kind of dive into some of the treatment because I just admire what you do when you're treating someone nonverbal with significant neurological deficits or developmental delays. I mean, what you do is amazing, but we are so thankful and so glad to have you as part of our organization, being the full family continuum of care, pediatric, geriatric, now here at IRG. Thanks, Vicki.
Thank you.
You've been listening to Vicki Schwartz, physical therapist and co-founder of the IRG Cascade Children's Therapy Clinic in Mill Creek. Children's therapy, something that's important to you. And as you mentioned, Shannon, you're kind of getting them now from the very beginning when the kids come in till the geriatrics all the way in between.
Yeah, we are so excited to have added Cascade Children's Therapy Services. I mean, the 4 partners that started that practice have established a great reputation. It's something that we're really excited to add as our service menu here at IRG.